Gluten is trash, man. I've been telling you guys this for a very long time, and I practice what I preach. When I got rid of gluten, even the little amount that I was having before, it has made a tremendous amount of difference. A lot less inflammation in different joints, okay? A much more stable gut microbiome substructure. It's just all around, a beneficial situation to find yourself in. So instead of me just going back over and over again, why just getting rid of gluten from my diet specifically, even though I don't have celiac disease, I don't have any other, intestinal issues. It's just the best thing for everybody. Let's just keep it a buck. So the most common reason that people give up gluten is because they get a celiac disease diagnosis. Now, what is celiac disease? We've probably gone over this before in the past, but it bears repeating. People can have different reactions to eating gluten. Protein in wheat, rye, barley, oats, and other less well-known grains such as triticale, farro, Eichhorn, isn't that the kicker from Ace Ventura? Spelt and Kamut. Gesundheit. Some people develop celiac disease, an autoimmune disorder characterized by damage to the small intestinal lining. That's what it should be. Previously considered rare, celiac disease is now recognized as common with an increasing prevalence in the United States and around the world. Maybe it was always common because the human digestive system isn't exactly, in the grand scope of things, all that accustomed for most of the cultures that are out there to consuming and eating a vast amount of carbohydrates, especially the amount that has been foisted upon us by the old model of the standard American diet or the food pyramid that was out there. What was it? 8 to 10 or 10 to 12 servings of grain a day? Like, just stop it. We know. We see the sponsorship ad that's below it. Anyways, celiac disease can develop at any age, including in elderly people. Oh man, that must suck. You're getting old to begin with, and then you throw in celiac disease where you're just going to get a whole bunch of inflammation and gut problems. That sucks. According to a 2020 article in Gastroenterology, before blood testing for celiac disease began in the 1990s, the classical symptoms that a doctor looked for were diarrhea, weight loss, malabsorption of nutrients, and growth failure in children. After blood testing, the disease began. Researchers gained a broader understanding of the wide variety of symptoms celiac disease could present with. Although diarrhea continues to be the common symptom, most patients receive their diagnosis based on what's called non-classical presentations. Well, shouldn't that be a different disease then? If normally something is characterized by one specific symptom, it's kind of a different thing. Like, it can present as the same thing, but it's something different. It's like, I got a terrible cough. Well, you got cancer too. It's like, well, can we discuss the cough? Because that's also making things bad. Non-classical presentation of celiac disease includes abdominal pain, bloating, constipation. Yo, that must suck if you got traditional diarrhea and constipation at the same time. You'd be in a world of hurt. Abnormal liver biochemistry. Neurological symptoms such as migraines, epilepsy, and ataxia. Oh, is that what Bruce Willis has? Aphasia? Anyways, or loss of muscle coordination. Iron deficiency anemia. Bone disease, including osteopenia and osteoporosis. Fatigue. Delayed puberty. Whoa. How much bread are these kids eating? Type 1 diabetes. Holy. Autoimmune thyroid disease. Down syndrome. Yo, what the? Gluten is causing Down syndrome? Oh my lord. Skin conditions such as psoriasis, eczema, and dermatitis herpetiformis. Herpetiformis. Your goofy looking skin. Yeah, that's kind of a drop off, okay? Because you got type 1 diabetes, where your pancreas doesn't work anymore. And then, Down syndrome. It's a little bit of a drop off too. And I got some blotchy parts on my skin. Like, you guys should probably tier this stuff a little bit better. Silent celiac disease is asymptomatic. Okay, so are we running back that old asymptomatic argument? Okay. Patients don't complain of any symptoms, but unknowingly have damage to the gut lining and malabsorption of nutrients. So you can't really say it's asymptomatic if you still can't absorb nutrients. It's like, I can't stay properly satiated, or I'm just living with obvious malnutrition. What's going on here? Well, you have asymptomatic celiac disease. Well, it seems awfully symptomatic now, doesn't it? Individuals with untreated celiac disease can have osteoporosis because of chronic inflammation and malabsorption of calcium and vitamin D. Whoa, that sounds like terribleness. These patients are at increased risk of fracture. Yeah, no doubt. Osteoporosis is pretty bad for bone structure, just saying. People with untreated celiac disease also have an increased risk of infertility, pregnancies of poor outcome. Oh yeah, you don't need to get into the specifics of that. That just sucks. And intestinal lymphoma, a small intestine cancer. Yo, stop eating bread. Are you scurred enough yet? In addition, the longer people with celiac disease go undiagnosed and continue to eat gluten, the greater the likelihood of developing another autoimmune disease and another one. People with the condition who are diagnosed and treated early, however, don't have an increased risk of autoimmune diseases. Well, that's good to see. What about non-celiac gluten sensitivity? If you haven't been completely scared out of your seat yet, what about what gluten does to somebody who doesn't have celiac disease, even if it is asymptomatic? Non-celiac gluten sensitivity, also called gluten sensitivity or gluten intolerance, is a condition characterized by gastrointestinal and non-gastrointestinal symptoms from eating gluten, but it isn't an autoimmune reaction. Okay, so it's just an upset stomach or a goofy stomach going on. Adverse symptoms can be developed within the first few hours up to 1 day after eating gluten. Okay, the symptoms can vary and can be very similar to symptoms from people that do have celiac disease. Okay, so we just got a wide range of things that can be categorized under the umbrella of celiac disease here. It's either you don't have it, but you kind of have all the symptoms of it, but some of the symptoms aren't included with the symptoms that you present. It's a goofy disease that probably needs a little bit better definition of its subcategories. I'll just say that. According to a 2014 Italian study, what do you mean that we kind of have the pasta? Published in BMC Medicine, the large majority of people diagnosed with gluten sensitivity report more than 2 gastrointestinal and non-gastrointestinal symptoms. Symptoms of gluten sensitivity include abdominal pain, bloating, diarrhea, nausea, gastroesophageal reflux disease, or GERD to its friends, tiredness, headache, anxiety, foggy mind, arms and leg numbness, joint and muscle pain resembling fibromyalgia. That's impressive. Anemia, depression, dermatitis, and skin rash. Again, you guys you don't know how to tier this stuff to be properly antagonistic. You got to put the fibromyalgia pain right at the bottom, and then probably, leg numbness and all that stuff. That seems like it's the worst, to just end on skin rash and different skin conditions. Yeah, this is a little bit of a drop off. That's my only criticism. Other research has indicated that gluten sensitivity can be primarily and at times exclusively a neurological disease. Sorry? Gluten sensitivity is found more frequently in adults than in children and much more common in women than in men. Oh, gluten is bad, women most affected. Although there still may be skepticism or lack of knowledge about the condition by some conventional medical doctors. Gluten sensitivity was first described in the medical literature as early as the 1980s. The reports have continued through the decades. In 2008, 2 important revelations about gluten sensitivity came to light. The first, which we learned about, is the important distinction between gluten sensitivity and celiac disease. With celiac disease, the innate immune system, the most ancestral form of defense we have against invaders, responds and coordinates with the adaptive immune system, a more recent branch of the immune system, to produce the autoimmune reactions that take place. With gluten sensitivity, only the innate immune system reacts to gluten. Later research confirmed the important role of the intestinal innate immune system in the development of gluten sensitivity without an adaptive immune response. Second was what we learned, that humans aren't alone with having non-celiac gluten sensitivity. Rhesus monkeys, who are genetically similar to humans, a lot of lab tests get run on rhesus monkeys because of this, have it too. One study found that many captive rhesus monkeys that were fed a monkey chow that doesn't sound great. That sounds like weird cannibalism. With gluten, had symptoms such as diarrhea, bloating, fatigue, depression, and skin rashes and blistering. Oh, that sucks. Nearly all of those had elevated IgA or IgG, anti-gliadin antibodies. I butchered that, I'd imagine, which some holistic practitioners believe are a good indicator of gluten sensitivity. Only a few monkeys had tested positive for celiac disease, but they still present similar symptoms. Okay, so there's something bigger at play here. There's no universally recommended methods to test for non-celiac gluten sensitivity, but here, chew on this piece of bread. Okay, how do you feel? Tell me how you feel tomorrow. Oh, okay, cool, you filled up a toilet. I understand. You probably have some form of celiac disease. we can run your blood, but other than that, stay away from gluten. You just keep it over there. So let's just get down to the meat of this situation, which you should be replacing your gluten with. Just eat more meat. It's all better. The only way to eliminate symptoms in both celiac disease and gluten sensitivity is to keep them from coming back, is to eat a gluten-free diet. It's really not that hard. This means not cheating on occasion or having just a bit of gluten, because guess what? It enters your system and those same responses begin to pop off. It's often easy for people who experience troublesome symptoms from either condition to avoid cheating because they feel so badly after symptoms flare up. However, it's also kind of, oh my lord, what is that? People who are lactose intolerant, okay? Whenever they have milk or ice cream or something like that and they don't take their, what is it called, lactate or something like that, they feel like absolute dog water the next day or even a couple hours later, okay? Like you need to set aside a bit of time. It's like, why would you put yourself at some disadvantage in order to just get a little bit of mouth pleasure? Pause. However, yes, people who don't have noticeable symptoms and have been unknowingly malabsorbing nutrients may find it more difficult to give up gluten-containing foods altogether. Yeah, if you don't see adverse effects, okay, if your poor decisions aren't negatively reinforced, why are you going to be giving them up? Okay, you have to present some sort of an argument as to changing somebody's life, especially if it's something that they enjoy. So, while I would advocate for just getting rid of gluten-free, it's not that difficult, but it's also not that clear if you don't know what to look for, okay? Yeah, the problem with gluten-free labels, sometimes they'll just slap a gluten-free sticker on like a bag of beef jerky. It's like it's salt and dehydrated meat. Of course, there's not going to be any gluten. You're just trying to mark it off of a health kick. It's like, yeah, just some jerky, okay, if you get rid of the tamari juice that would be in it, or soy sauce, because there actually does contain gluten in the soy sauce, so you want to kind of steer clear of that, okay? There are certain things that and it's like, honestly, if there's any kind of wheat or grains that are going to be in it, chances are you're going to come across some gluten, so maybe keep that stuff over there for other people to consume and suffer the consequences of. You can't always take a look at a gluten-free sticker and just go home and be fine with that, because they could be kind of cooking the books a little bit. To eat a diet with no gluten, you have to buy food that is truly gluten-free. When you see a label that says gluten-free, you probably assume that it means no gluten, but that isn't always what it means. The FDA's gluten-free food labeling rule, why was that so difficult to say, which was finalized in 2013, specifies that foods that carry the label gluten-free, no gluten, free of gluten, or without gluten must contain less than 20 parts per million of gluten. Whew. The number of celiac experts thinks that amount is too high, okay? Some, including registered dietitian Tricia Thompson of glutenfreewatchdog.org and Peter Olness, a biochemist who runs the website ultimateglutenfree.com, have urged the FDA to lower the 20 parts per million to 5 parts per million to protect people who say that they react to and get sick from very low levels of gluten. Yeah, that trace amount of gluten, because I don't necessarily know if 20 parts per million is all that much or even a noticeable amount, but that can also come across specifically if you're dealing with things that are fed or raised on grain products. You can, by proxy, end up consuming what that animal was consuming beforehand, or if it was just mixed in the same refinery. Like, you see those labels that also say may contain peanuts and soy. It's like, but it's just like canned fruit. How is that possible? It's in the same vicinity. It's in the air. It's in the ventilation and all that stuff as well. Perhaps that's what's happening here, but I don't know exactly for sure. Overall, though, there's limited research and much uncertainty about the threshold of toxicity for gluten in different people. Toxicity referring to the amount in which elicits a sort of response that's in your body. New Zealand and Australia have the toughest labeling laws in the world. These have been set by Australia and New Zealand Food Standards Code. But then again, hey man, if you want honest labeling that's out there, you'd also have to sacrifice your freedom by moving to New Zealand or Australia. I wouldn't recommend that. These have been set by the Australian, Standards Guide and apply to all food sold or prepared for sale, including imported food. And there's, zero gluten in that. The risk of gluten contamination. Okay, maybe this will elucidate to the point that I was just elaborating on. Many practitioners who prescribe a gluten-free diet recommend eating naturally gluten-free grains. I wouldn't even say grains at all, but I'm kind of, keto and paleo supremacy. Seeds and flours. But these foods are often at risk of gluten contamination in a study published in June of 2010 in the Journal of American Dietetic. that's a word, association that found that 9 out of 22 inherently gluten-free products such as corn and millet, why are you eating corn to begin with, contained mean levels of gluten ranging from 8.5 to 2,925 parts per million. Holy! Also, 32% of naturally gluten-free grains and flours tested contaminated with gluten in amounts greater than 20 parts per million. Yeah, pay attention to that stuff, okay? Make sure that it's organic and make sure that it's definitely 100% not processed, okay? Eat stuff the way that it's grown, okay? Just try to stick to that standard. Given those findings, gluten contamination of inherently gluten-free grains, seeds, and flours not labeled gluten-free is a legitimate concern. Protect yourself from gluten-free grains, seeds, and flours that are processed in a dedicated gluten-free facility and are batch tested for gluten. Or look for products that have been certified gluten-free logo by the Gluten-Free Certification Organization, which verifies that there's no more than 10 parts per million gluten contents in a tested food. The standard is twice as strict as the FDA for gluten-free, and we know how far we can trust the FDA, which is not very or at all. The best way to go gluten-free, stop eating grains. Just stop it. Stop it. Get some help. To eat no gluten, or as close to that as possible, emphasize fresh fruits and vegetables with unprocessed meats, eggs, and fish. Yeah, no, exactly. Eat a paleo, eat a Mediterranean, eat a ketogenic diet. Eating those naturally non-gluten foods and cooking them from scratch is the best and safest way to avoid unwanted gluten, and long and short of it is, you kind of want that. If you can't quite figure out why exactly your guts are just kind of acting up, why you're a little bit sore, why you might be breaking out in a certain rash that you can't quite figure out because everything else is on the up and up, chances are, and long and short of it is, whenever there's something that you can't quite figure out, it can be solved by just tightening up your diet. So like I always say, man, get rid of dairy and get rid of gluten, and you can just see the changes that are just naturally going to happen in your body. And guess what? I know it's Friday and all that stuff, and you can go ahead and make the right choice by making that decision as of right now. Don't be Don't be snacking on anything this weekend that has gluten in it, and just, you know what, hey, just put a pause on that stuff and just see how you feel Monday morning, okay? Hey, man, trust me, it might seem like a bit of a task, but it'll pay off in spades, trust me. With all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.